So, the reality is that whenever we talk about pregnancy, we also have to hold space for the possibility or the experience of miscarriage and pregnancy loss. I understand that this is a super, super sensitive topic, and it's one that our culture really doesn't understand how to honor and support people through. As a midwife, I know that it is essential to offer information about miscarriage and that this can actually be empowering and supportive to many people. Through talking about miscarriages and offering resource for support and healing, we can demystify the grief-full experience of miscarriage and help people feel more supported and nourished through pregnancy loss. So if you're pregnant and you think that watching this video will increase your anxiety and end up causing more harm than good, please feel free to close this tab and explore another video. If you're pregnant and interested in learning more about miscarriage and you think that that will help you feel a deeper sense of empowerment, welcome. And if you're experiencing or are in the aftermath of experiencing a miscarriage, I deeply hope that this information can support you during this really intense time of loss. A miscarriage is when a baby or fetus dies inside the uterus before 20 weeks of pregnancy. This is also sometimes called an early pregnancy loss. The vast majority of miscarriages happen in the first trimester. We know medically that about 20 to 30% of known pregnancies end in miscarriage. It's possible that the rate of miscarriage is actually much higher, with some studies claiming it could be close to 50% of all pregnancies, and that includes people who didn't realize that they were pregnant in the first place. The vast majority of miscarriages are caused by chromosomal abnormalities in the growing fetus. In these cases, there's nothing that could have been done or not done to cause or prevent the miscarriage. Other far less common causes of miscarriage include what's known as cervical insufficiency, which is when the cervix isn't strong enough to hold the pregnancy inside the uterus, which is usually due to a previous surgery or trauma on the cervix. Infection, drug use, untreated health issues in the pregnant person, such as uncontrolled diabetes, thyroid disease, or in some cases, the MTHFR gene mutation that causes a folate deficiency. When most people think of miscarriages, they imagine a spontaneous miscarriage, where a person notices spotting or bleeding, then experiences progressive uterine cramping that pushes the body to miscarry the pregnancy. There are actually a lot of different ways that miscarriages can look, including some of these ways. So a chemical pregnancy, where a pregnancy ends before 5 weeks. Spontaneous miscarriage, as I talked about earlier, where the body spontaneously expels a pregnancy that's no longer viable. For many people, this can feel like getting a period, but with really heavy and intense cramps. And often the emotions surrounding the pregnancy loss can make it harder to cope with the physical intensity. Once the body has passed the pregnancy, bleeding may remain heavy, but should taper off significantly. It can also be normal to experience some vaginal bleeding for a few weeks after the miscarriage, but the bleeding should become progressively lighter within the first day or two of passing the products of conception. Another type of miscarriage is a missed miscarriage, where a miscarriage is diagnosed through not seeing a heartbeat on an ultrasound, but the body doesn't automatically expel the pregnancy. We'll go over some management options for this type of miscarriage experience later in the video. Then there's threatened miscarriages, where there's a period of maybe the baby is measuring small on the ultrasound, or the pregnant person is experiencing spotting with an unknown cause, such as a subchorionic hemorrhage. And this can be a time of heightened anxiety because of the uncertainty. Then there's an incomplete miscarriage, where a pregnancy does not pass completely from the uterus, leaving the body trying to expel the remaining pieces with continued bleeding or spotting that does not resolve within a few weeks. This, if it's not caught and treated, can lead to an infection and too much bleeding. And so an incomplete miscarriage often requires medical attention, and we'll talk more about warning signs related to miscarriage too. During a miscarriage, it's normal for people to experience progressive cramping and heavy bleeding. So that means soaking 2 large pads an hour for 2 hours. And then they often pass the products of conception along with clots up to the size of a lemon. Then they experience a shift to lighter bleeding after the pregnancy has passed. So it's really, really important to reach out to your provider if you're experiencing miscarriage symptoms, and to definitely seek medical attention if you're soaking 2 large pads an hour for more than 2 hours, if you're feeling lightheaded or faint or experiencing continued heavy bleeding for more than 24 hours, if you pass a clot or clots larger than a lemon, and if you experience any miscarriage symptoms in the second trimester. So let's talk about treatment options in the event of a miscarriage. So in the event of a missed or incomplete miscarriage, the person miscarrying has the option to follow their body's lead to pass the pregnancy naturally, or to use medical interventions to complete the miscarriage. So let's talk about the medication option. A miscarriage can be completed with a medication combination of mifepristone and misoprostol. These are medications that will trigger the body to expel the pregnancy. Unfortunately, depending on what state you live, it may be difficult to access these medications because they can also be used for first trimester abortions. This medication can be taken either as a vaginal suppository or orally, and it usually causes complete miscarriage within 24 hours. It's really safe, it's non-invasive, and it also allows people to remain at home to pass the pregnancy. It does, however, cause painful cramping that can last up to 24 hours. Some pros of this method is that some people appreciate being in the comfort of their own home. You can also save the products of conception if you'd like to bury them or do some sort of closing ritual with them that can aid with healing. And we'll talk a little bit more about healing from miscarriage later on in this video. It's also a relatively non-medicalized experience, and you don't need a speculum or you don't need to interface with the doctor's office. The cons, though, of a medication-assisted miscarriage are that the cramps can be painful and intense and can last for up to 24 hours. Some people prefer being under medical care and completing the miscarriage process as efficiently as possible. So let's talk about another option for managing a miscarriage, and that's called a DNC. So a DNC stands for dilation and curettage, and it's when a doctor or a midwife uses a speculum to see the cervix and a sterile tool to open the cervix and then to remove the contents of the uterus with another type of sterile tool. So the pros of a DNC is that it can be quick, and usually, depending on how far along the pregnancy was, takes about 5 to 15 minutes. People who feel safe experiencing medical care may prefer this more medicalized approach to completing the miscarriage. The cons are most of the time you can't take home the products of conception. And for people with a history of sexual or obstetrical trauma, the experience of the DNC can be uncomfortable and triggering. So let's talk about expectant management, which is also known as the wait and see approach. So depending on what's going on, it is possible to wait for a missed miscarriage to pass spontaneously, as long as there's no significant bleeding, signs of infection, or any other causes for concern. On average, a missed miscarriage usually completes within 2 to 6 weeks of expectant management. 80% of people doing expectant management will complete a normal miscarriage at home. Some folks also take herbs such as parsley or cotton root bark to encourage the uterus to release its contents. If expectant management doesn't yield a complete miscarriage within 6 weeks, it's recommended to take a medication or have a DNC to avoid infection or a really rare condition called disseminated intravascular coagulation. So the pros of expectant management are that it's a natural approach that allows people to follow the lead of their bodies. And for some people, it supports their experience of closure because they aren't forcing or rushing the process of completing the pregnancy. The cons of expectant management is there can be a sense of question of when the miscarriage will complete, and some people feel really ready to complete their miscarriage process before their body might be. And sometimes the body won't actually release the contents of the uterus and will require medical attention. It's really rare, but there are some serious health concerns if the body doesn't release the uterine contents within 6 weeks, and so I definitely recommend talking to a healthcare provider about it. It's really important to receive follow-up care from your provider after a miscarriage in order to confirm that the pregnancy has completely passed. This can be done through a blood test or an ultrasound with a midwife or a doctor. People with a negative blood type do need to be given a RhoGAM injection within 72 hours of the start of bleeding to prevent complications with future pregnancies due to the risk of Rh sensitization. So, experiencing a miscarriage is a profound loss, and people react so many different ways physically, emotionally, and spiritually. There's no right way to go through a miscarriage, but I do recommend feeling your feelings, embracing your grief, and giving yourself the time and space you need to process this experience. Our culture doesn't really know how to support people through miscarriage, but I encourage you to carve out space for yourself to heal. So here are some suggestions that have supported people through the experiences of miscarriage in my practice. So as I said, process your feelings and embrace grief. It's so important to give yourself the gift of feeling your feelings and embracing your grief in the event of a miscarriage. No matter when the miscarriage occurs, it's a profound loss, not just of a potential child, but also of all the ideas and the hopes that you very understandably attach to the pregnancy. Feeling and processing your feelings will help you understand them and eventually heal. Another idea is to do a simple ritual. So a simple ritual to mark the end of the pregnancy can be a powerful way to honor the pregnancy and experience some aspect of closure. So some ideas include writing a letter to the little one and then safely burning it or letting it go into a moving body of water, burying the products of conception or using some symbol that represents the baby, making art or creating a symbol that represents the baby and giving it a place of honor in your home. And whenever doing any ritual, I always recommend sticking with practices that are familiar to you and feel connected to your own ancestry and cultures of origin. Journaling. Journaling is a really powerful way to release and process thoughts and feelings in a non-judgmental way. It can be powerful to give yourself that space, sometimes multiple times a day for however long that you need. Speak to friends and professionals. It's so essential to break the silence around miscarriage and share your experience with friends, loved ones, and or a professional therapist. There are therapists and coaches who specialize in supporting people in the perinatal period, and I highly recommend reaching out to them if you have access to professional therapy. Remember, it's not your fault. I can't stress enough how common it is for people to internalize some level of blame in the aftermath of a miscarriage. Remember, there's nothing that you did or didn't do to cause your miscarriage, and it's not your fault. Sometimes it can be helpful to write that down on a piece of paper and put it up on your wall as a reminder. Reach out to your people. Even though our culture doesn't discuss miscarriage out in the open, it doesn't mean that we need to follow its lead. I recommend, when possible, finding 1 or 2 trusted people who understand what you're going through and lean on them for emotional and or material support. In our community, Pregnant Together, there's also an area for people healing from miscarriage, and there's a chat and also other resources that can support people during that time. And it's a really good way to connect with other people. So back to the topic of material support, having material support can be super supportive during the aftermath of a pregnancy loss. You can ask a friend to set up a meal train for you so you don't need to worry about cooking, or call on friends or family to take care of existing children or walk your dog. Even if you don't feel like seeing or talking to anyone, feeling that extra material support does make a difference. And also, if you have a primary relationship, be gentle on it. Grief and pregnancy loss can be really stressful on relationships, and that includes with our partners as well as our closest family members. So try to remember that everybody processes grief differently, and bring gentleness to your relationships whenever possible. So from a medical perspective, there's not necessarily a recommended right time to start trying to conceive again after experiencing a miscarriage. Actually, there is some evidence that shows that people's fertility increases slightly in the first 3 months after a miscarriage. But it depends on so many factors, notably your emotional state and your grieving process, as well as other factors influencing your ideal timing for trying again. It's really a profoundly personal choice. And it is at least recommended to wait 2 weeks before your next insemination or intercourse attempt to reduce the risk of infection. So there are some places to find extra support after a miscarriage. I'm going to link the websites and organizations in the description below that offer some more support after experiencing miscarriage. And again, check out the Pregnant Together community and see if it's the right place for you, where you can connect with other people going through some similar experiences. Take care.